Good afternoon. This is On the Sofa with Rouge with the Infinity Group, and I'm delighted to be joined by my mate, Dr. Krish Rawal, who is here with us, with me today. He's the medical director of the Infinity Group, and he's here to give you some insight into men's health. So, Krish, we're going to be talking about men's health today.
Okay, good.
I've got some facts for you that I want to discuss with you, because I've been reading up that apparently 24% less men want to go to the GP than women. So women are more likely to book appointments. And I live with two men, so I know what this is like. I book all their appointments, and sometimes I have to really push my husband into agreeing to go to one. So what is it with men? Why is this happening?
Well, the first thing I suppose to say is we've just had Men's Health Week, which is a very clear statement that we have to have a whole week dedicated to making men more aware of their health and health-related issues. So that in itself says, men, you are not engaging enough. Secondly, I think some of it is cultural, but I do think things are changing. So that's the kind of good news. But I think it is very much a cultural thing. Men very much feel it's all about, I'll just get on, I'll just put up with it, it'll get better.
It's the traditional man that's more like this, because I think we have quite a lot of young men now who you see them around the street, they're all like pumped up. I call them beefcakes, because they are literally like beefcakes. No, they're like pumped up, and they're all the same, really tight shirts, and their muscles, their guns are bulging and all. But then there's a whole bunch of other men, I think maybe the older generation, who are not into, who leave it all to the last minute. The cultural repair kind of approach, which means that they wait till something is super urgent.
Until it's broken. As opposed to preventing it breaking in the first place.
So is that, do you see that as a GP?
Much. So I see a lot of men who come with their wives and with their partners, either with or sometimes alone, but tell me, my wife told me to come. I wasn't going to book this appointment, almost like it was an apology. Like, I'm so sorry that I'm coming. I didn't mean to come. I'm sorry to bother you, but I've got this major problem that's been there for years. For me, some of the frustration with that is that some of these men come with problems that have been there for years. And we all know it is very much a truism that the sooner you deal with a medical problem in particular, the easier it is to fix. So to come with a long-standing back problem, or a long-standing kidney problem, or whatever that thing is, or blood pressure problem, and it's been there for years, is very much harder to deal with than
or to
deal with it from a preventative and an early management perspective when things aren't so bad. And perhaps, blood pressure being a great example, if you leave blood pressure for a long period of time, over a short period, the body can adapt very well. The body's a very, very resilient thing. But over years and years and years, if you don't calm, you don't sort it out, ultimately there will be damage elsewhere, which perhaps can't be reversed. And what a shame, for the sake of a very simple appointment months or years before.
So I was reading also that men are more likely to smoke more cigarettes, more packets of cigarettes a day. They eat too much salt. And the other thing was the red meat. So I like my steaks. Now and again, I go to a restaurant like everybody else and have a steak. But whenever I've gone to this restaurant that I like, there's always like a table of blokes, table of lads there, all with their big steaks, It's not good to eat so much red meat. I suppose in moderation, is it all right?
Well, interesting that you use a very interesting bit of language there. You said a table of blokes. So, and of course you use that, I know it's very much an English expression, but it is an expression that kind of gives this impression of, slightly macho, this kind of, hard drinking, hard smoking, hard steak eating kind of man. So it's even culturally within all of us to use that kind of language. I think because of that cultural issue, I think that's why men perhaps are statistically shown to smoke more, eat more salt, maybe eat more higher protein, red meat, things like that. And we all know it's bad for you to a certain degree. In moderation, absolutely, for everything. Please do have a steak if that's your thing. Please occasionally put a little bit of salt on your food if that's your thing. But moderation, definitely. And I think a lot with men, the reason why they are statistically shown to be worse at this is because they don't engage so well. So they come later, so they don't see the consequences of what they're doing until perhaps it's too late. Women are far more proactive. They are booking the appointments for themselves, looking after themselves. They're booking the appointments for their sons, for their husbands, for their daughters, for their extended family, all of them, to be much more proactive. And I think because of that, women see the benefits of being more proactive, and the screening tests in particular, but they also see the benefits of catching bad habits, for example, or health problems early. So that's why I think they're increasingly better engagers for themselves and for their families.
The other thing I wanted to mention, which is really important, is that the suicide rate for under 35s in men is much bigger than in women. And this is a big worry. This is all to do with mental health and maybe men not being so open about their feelings. Do you get that as well?
Yeah, very. I think
finding it hard to
express. I think again, you see, that statistic about the suicide rates is quite an interesting one, because I do think generationally things are changing. I do think younger men are now becoming much better expressing, much better at engaging with health services, and much better at shedding that taboo about mental health, for example. But equally, yes, still, and it has been, if you look historically, that men do have higher suicide rates by and large, for lots and lots of reasons. It may be a health reason. It may be purely and simply perceived on their part, societal pressure to be the provider, to be strong all the time. To be the strong. There's a film that's been out very recently on the BBC in the UK called Silent Men, which is exactly about that, about men suppressing and just being seen to not be weak, not be vulnerable, and all these things. The trouble is, of course, interestingly enough, actually the strength now comes from engaging and saying, you know what, I'm actually not doing okay at the moment. Yes, I admit I've got lots of people depending on me, so as a result I need to look after myself. So I agree with you that is a statistic which we are still doing our best to manage.
I think Jib Sams, for example, are doing an amazing job of getting the message out there. I mean, you see it the whole time on social media. I think it's really important. But I think we need to discuss it. I think people need to talk about and be more open about these issues. To do with men and to do with the suicide rate.
This impression of being, almost on your own. But I think also, like I say, culturally, I think things are changing. I think there's much, much, much more equality in relationships now. The traditional impression of a household has almost completely changed now. So it's very much more about equality. Everybody has equal standing. No more of this, this kind of very, very outdated. Men have one role, women have the other role.
I want to talk about prostate checks and men's well-man checks. I know that there are well-women checks, and my husband actually at work, which is quite good. So at work, there are some companies that come around, some people that come around and offer well-man checks. I suppose the companies pay for it. But that's how my husband discovered he had high blood pressure. So he didn't know he had it until somebody came around to his office and gave him this free check. And that's when that's really good. Are people doing that? The GHA, for example, offering that service as well?
So there's a lot more from the medical side, understanding for well-man and well-woman check side of things. So GHA, for example, we have our well-person unit, which does both well-man and well-women checks. It's interesting you mentioned about blood pressure, but there are a number of medical issues which you don't know you have until somebody looks.
Like cholesterol. That's another one.
Correct. So these are silent things. You don't feel any different from one day to the next. And of course, again, we were talking about leaving things for a long period of time. So these are the things to catch early. Some of the issue, I think, for men and women actually is looking for something which potentially might be wrong and then worrying what happens if it is wrong, and then I've got to take tablets or I've got to have treatment. So there is always a bit of a for some people not to engage because they don't want the bad news or the potential for. But certainly women are much better. We know that when it comes to the screening services, and women's screening services are very much more in our minds in terms of things like mammography and cervical screening and these kind of things.
But we were saying before, prostate cancer,
Yes,
or the prostate
course,
cancer
same thing.
support group
Yeah.
is really out there as well, putting stuff out all the time.
Hugely, very, very, very active, and they have, and the prostate cancer support group, in particular, where they have really, really, really been very strong and have really won is catching men, including some men who were part of when the group themselves set up, were found to have prostate cancer they didn't know anything about.
Yeah.
And of course, that message comes from some of the founders to say to other men, please just get it checked. Now, prostate as a screening test is really the only proper screening test for men specifically. We have across the board, we have in common, we can check things like cholesterol, and we can check blood tests for, kidney function and liver function.
That's from a routine kind of blood test,
for everybody.
Which you should have every year, shouldn't you really?
Yeah.
Like an MOT.
You should really,
once.
yes, as part of looking after yourself as well, not relying on that to catch everything. Relying on
of course.
a good diet and exercise and good sleep and looking after yourself as well. The prostate side is open to a lot of controversy. So there was an article published from a big study in the UK very, very recently, which looked at the value of what everybody understands for prostate, which is what you've very eloquently put as the finger up the bum.
Yeah, the finger up the bum. I mean, you mentioned, I mean, it's not the nicest thing. I've never had. Well, anyway,
of course.
But when a man has to go and have that checked, or he's told, look, you better get your prostate checked, the first thing they think is, I'm going to have someone's finger up my bum. And actually, it's not, from what I'm being told, it's not the nicest experience at all.
It's not.
As a doctor, well,
it's not the top of your list of things to do. Let's be honest. So, medical term for it is the digital rectal examination, the DRE. Let's call it that because it's an easy way.
But how can it be digital if it's somebody's finger?
Because that's your digit. Yeah. No, it's not digital.
It's not fair. That's giving the wrong idea. If you tell someone it's a digital, they're never going to take it.
Actually, when they looked at that particular examination, they found that, number one, the examination is very unreliable, because when you do that, what you're actually feeling for is just the back of the prostate.
Yeah, the walnut, not what they call the walnut.
Yes, but you're feeling the back of the walnut, not the rest of it. So there's a lot potential to miss.
Yeah.
Secondly, and they asked the question, does the DRE cause harm? Now, it doesn't cause harm in terms of what you do it when you're doing it, but it does cause harm in that it's a massive off-put for men. So there are men who won't engage in coming to have their prostate checked because of that potential. So the recommendation has been, and in a lot of medical practices, particularly in the UK, where this study was initially published, they are not doing it so much anymore. So you can go and be more or less confident that somebody's not going to throw you onto a couch and say, right, we need to do this examination.
How else can you have it done? Right.
So the first thing is we can do with a thing called a PSA, a prostate-specific antigen. It's a blood test. Yes. It's quite an unreliable test. So as a doctor, you have to tie that together with any symptoms of problems like infection and difficulty passing urine, maybe some delay as men get older, their prostates get bigger, and when they go to the toilet,
it closes around the urethra, and that makes your peeing flow not so good.
Correct. So you have to tie it together and use it as part of a specific test.
Yeah.
And there are other little things. So if you press on the prostate, for example, if you're a cyclist, lots of men, particularly in their 50s, when they run their knees into the ground, take up cycling, for example, they cycle on these tiny little saddles which press their prostates, and that pushes up the PSA. So we have to brief men to say, don't have your blood test if you've been cycling 72 hours before. There are all sorts of other things. You have to be very careful to have a gap between your blood test and when you last had sex. All those things.
Really?
So it's a little bit specific, yes.
It's interesting.
Because it's quite a sensitive and therefore can be very unreliable. However, that should not really be an off-put as such.
Yes.
A lot more men should be engaging in that one, asking for that. And I do have lots of patients who are very, very good at saying, please, can we check it?
Yes.
I want to know my number.
Yes.
And really for us, it's more about trend. So for example, if you see a normal one, we keep an eye on it and watch. So if it goes up, we check it again to see if it goes up. And if it's starting to climb a little bit, that's the point where we would refer you to the urologists, the plumbers.
Yes.
And they would then advise on other investigations such as ultrasound, or more commonly these days an MRI scan of the prostate, to have a look properly and see what's going on. Yeah.
How can we support our men, Krish? What is the best way to help them, apart from just getting the appointment and making them go?
Well, I think that's probably the most important one. And I think, like I say, culturally things are changing and awareness is changing. A lot more messages are going out there now. There's a bit more balance. Before, the message was very much focused on cervical screening, breast screening, all of these kind of things. So there's more airtime, I think, dedicated to men and their health screening. I think really the key is always that we all need to have the same consistent message, which is healthy lifestyle. Clearly, you mentioned about salt and smoking, alcohol, eating red meat, everything in moderation to a certain degree. We all have our habits of things we enjoy.
We like, exactly.
Perhaps.
Yeah, because what the first thing they're going to say, or people will say, is, "Oh, how boring! I can't eat meat." I remember when my dad was told, "You're diabetic, you can't eat cakes." It was like he wanted more cakes. He wanted to eat more sugar when he was told he couldn't have it. It's a bit of a psychological thing.
I agree, and
it's silly.
And people, but the point being that you say to somebody, okay, you come for your health screening, well done for being proactive. I'm sorry to say that you've got a high sugar and you've got cholesterol, so you can't eat, you can't drink any more alcohol, you can't eat cakes, you can't eat steak, and you have to basically eat boiled vegetables and drink water. At which point, by and large, they're going to walk out the door and just go, stuff it, I don't care anymore.
Yes.
So we have to, the message really, for me, loud and clear, always has to be, number one, moderation with all these things. Number two, if you are not somebody who looks after yourself in terms of exercise in particular, and of course we're talking here that we're talking about Infinity, for example, supporting this. We've got extensive gyms everywhere, fantastic personal trainers, amazing equipment. We've published a series of articles recently about health benefits and benefits of not only the gym and the personal trainers, but also now the spa and the relaxation. So we're really saying, okay, so you like to eat cake, for example. I know it's ridiculous. Okay, you like to eat your steak. Okay, God forbid, but yes, you do enjoy having a couple of cigarettes on a Friday night when you go out for a beer, because that's part of this whole thing. If you are going to do that and you are resolved to do that, despite some of the evidence to say, please try not to, because you say, no, you know what, actually I want to do this, I work hard, I do a good job, I look after my family, I have my in which case, try and counter that by engaging in some decent exercise. Speak to one of our personal trainers. Develop a program that's going to make you feel better and stronger. Take up some swimming, take up some stuff in the gym, cardio or weights, whatever that thing is. Something that you're going to enjoy. To basically say, I'm going to exercise, and when I finish exercise, I'm going to have something that I enjoy. And it's all about balance. Completely.
Yes. Yeah. How big is the diabetic problem in gym?
It's significant, but I wouldn't say that that's in gym. I think the diabetic problem in general is, people use it very loosely, but I think it's true. It is a crisis. We have a diabetic crisis across the world.
And more men than women, do you think?
Difficult to say, really, again, because men are not engaging in the screening, so very difficult to say. But I think generally, if you look at rates of diabetes, of obesity, and dietary changes, I think that in particular is across the board. The issue is perhaps for men who are maybe more likely to be smokers, more likely to eat more salt, more likely to drink more alcohol, and have maybe more meat-related diet, put that together with diabetes, and maybe the rates are the same, but the impact is greater.
Yeah, so it's all about healthy choices, really, and making and thinking, maybe changing your thought process a little bit, and think, well, if I have it checked and something comes up, then I can sort it out beforehand.
Sort it out early. Yes. And I am going to resolve to have the things that I enjoy. Yeah. But maybe I'm not going to have the sweet things every single night during the week. I'm going to have them at weekends, and I'm going to balance that by doing some exercise, engaging with a personal trainer, engaging with my friends that go to the gym or do exercise, and just improving my lifestyle. And interesting, as you start to become fitter, you'll start to realize, you feel better, and you start to realize how much nicer it is to feel well. By and large, you will naturally change your habits. You'll probably at that point go, you know what, I feel so good, I'm not going to smoke anymore, or I'm going to cut my salt, I'm going to change my diet because now my diet is helping me with my training.
And you look better now. It's the beginning of the summer.
Yes.
And everybody's out there with as little as they can on.
Yeah.
So I've seen.
Yeah.
Another important issue is sun damage.
Yeah.
This is another thing that I think I'm one of those that just loves lying in the sun, because I never really burn.
Yes.
Although I did burn a bit, but it's not good to do that. And I think my husband yesterday was like, I forced him to put some sun cream on because he's got very fair skin.
Yeah. Yeah.
But, I mean, men usually don't wear sunscreen.
They don't. No, I'm grinning.
Am I right or not? I was looking at the beach thinking I'm going to be chatting with Krish tomorrow, and I'm going to have a look around, see. And the women are really into it, and they cover all
and covering,
their faces, especially. The kids. Skin. But the men just sit there.
Yeah. But I think that's all part of what we're talking about. Part of the same engagement with everything health related.
Yeah. Do you think like Scandinavian countries are more the men in like the north of Europe are more kind of I don't know, more like women, more like?
Well, the Scandinavian countries, I mean, it is a generalization, let's be honest, but the Scandinavian countries are known for being much more proactive when it comes to health engagement. Yeah. I think across the community. So by default, that means men as well as women. They are much better at this. The nations themselves are known for being much healthier. They have a lot more. They have a much more in their culture towards being healthier, being fitter, these kind of things. And their rates of smoking, say, comparison to Europe, are significantly less, lower. Yeah, but interestingly enough, if you go to some of the Scandinavian countries, you can kind of see where this has come from, because to buy a packet of cigarettes over there, it costs you might as well take out a mortgage on a packet of cigarettes and a bottle of spirits, for example. So, there are ways and means around it, aren't there? Yeah.
And living in the Mediterranean is not the easiest place to do this, because we like going out, we like partying, we like having a drink.
Yeah.
If somebody's smoking, you might feel like having a cigarette too. That's what happens sometimes to me. I don't smoke, but if I see somebody having one, sometimes I think, oh, how nice.
It's very much like,
it's
very much a lifestyle thing, because we have the sun.
Yeah.
The bars and the restaurants are open. They're outside. It's warm. The first drink of the evening is the coldest. It's all part of that whole.
It's all part of our culture.
Yes.
And also, then you go over to Spain, and everybody smokes in Spain.
Yes. It's very noticeable.
I noticed that yesterday at the beach.
I went across the border the last week, and I just thought literally everybody here is smoking.
Yeah.
Amazing.
So there are some positives about living in Jib, about what's happening now, about the social media awareness campaigns.
Yes.
All the man-friendly adverts for men to open up about their mental health and all that.
So,
and of course,
very much Gibraltar being a small place, we have the beauty of being able to reach every member of the community very, very easily. We also, because it's small, we have we've mentioned already, a very extensive network of gyms that can provide you with advice about it.
Exactly.
If you are somebody who's not a gym goer, or maybe just new to exercise in general, you just don't really know where to start. You think, well, okay, I understand I need to do some exercise, but I've no idea where to start. I don't fancy taking up running. What do I do? And it's a great place to go and just kind of walk in the door and say, look, I could do with some help. How do I do that? And Gibraltar's very, very good for that, because we are so small. Community is very supportive. There's always somebody on hand to give you advice, but there's always a place to go to get that advice as well.
Yeah, absolutely. The Infinity Group have a bit of everything.
Yes.
And the Reshape and Rumble classes.
Yes.
There's no escape. There's no. You honestly, you go.
Yeah, but you can't call it escape, because then everyone goes, "Oh, I'm not going then." Yeah.
No, but I think also the whole point that you're going with other people. You're going to meet people there.
Yes.
This has also helped you. Then you'll see one person. Oh, you've lost a lot of weight, and that kind of spurs you on as well. I think that happens a lot in Jib as well.
Yes, and actually, it's interesting, isn't it? Because for a small place, you see so much going on. There are a lot of running clubs, a lot of running events that you'll see, particularly weekend.
Yeah, every weekend morning. There's like a running group,
which is amazing. And then you obviously have people who
and cycling,
who do a lot of cycling. you have people that do a lot of walking up the rock. You know, we've recently had the MedSteps 5 challenge to take people and show that actually, you know what, MedSteps is a very beautiful place, and you can do it. You don't have to do it on your own. You don't have to worry about even where MedSteps starts. You can go with a group of people who will show you, and you can do it at your own pace. So there is a lot more here for lifestyle. Actually, very interestingly, when we're talking about, you say about the steak place that you go to, you know, you will see increasingly now some restaurants that are coming online which are much more vegetarian solely, vegan as well, and if you are somebody who tends to be very traditional in what you eat, there will be no harm in going to one of these restaurants, giving it a try to actually see, you know what, vegetarian and vegan food is, when it's done properly,
it's really good.
Amazing. And you can actually say, you know what, I don't need to eat meat every night because this stuff is just as interesting.
I for one, used to eat meat a lot, and now I try not to eat meat at night at all. So I try and do like a more vegetable based dinner.
And you feel lighter
and
for
eggs,
it.
And and I sleep better as well, because I find that if I have a steak at night, then I get this awful kind of heartburn or indigestion, and it bothers my sleep, and that then gets me irritated the next day. I think a lot of people of my generation are feeling that now. You get to a certain age and you start getting a bit like that. But I mean, everybody could benefit from eating a little bit lighter at night as well.
And actually, the options for changing in diet or a change in diet are huge in comparison to, if you rewind, say, 10, 15, maybe 20 years ago, to try and go vegetarian at that point, or I'm not saying entirely vegetarian, but go kind of, you know, like just slightly less meat in your diet, was very, very difficult. Now there's lots and lots of options to buy things that you can use as substitutes, which taste great. So it's all about, like we said a few times, balance, moderation. Have what you want, but maybe not every single day kind of thing, and just make it change it up and make it more interesting.
Okay, so there is hope for our lads in the world.
There's hope for us all. But for men in particular, I think things are changing. I think it's more than hope. I think things genuinely are changing. Men are becoming much more interested in health-related matters. I think also it's being helped by medicine itself moving on. So this piece of work about not having to go for the DRE to the doctor's surgery, huge plus. And I think in just as men see, you know what, things are changing, matters in our favour, I think they will start to engage more.
Good. Well, I hope they do. I hope a lot of men have watched this and have found our chat interesting.
Yes.
And thank you very much, Krish, for sharing your insights.
Thank you. And of course, any men, anyone, I'm not offering, but of course, for the men that don't tend to engage, please come and see us, you know, in the GHA. Come and speak to your GP. Come and speak to a clinician. Please have a little think about your health. Maybe let's get some exercise into the mix. Have
a look at what the Infinity Group has to offer.
Exactly right. And engage with your GP or healthcare professional.
Yeah, for sure.
Seek some advice, and also if you're somebody that is on medication, you have a chronic disease already or something, and you might be a little bit uneasy about engaging with exercise and walking into the gym and starting those things, always have a conversation with your GP first, and just check and let us know, because there might be a few little hints and tips that we can give you.
Okay. Well, thank you very much.
Pleasure. Thank you.
We'll catch up again soon,
yes,
I'm sure.
I hope so, for the next one. Yeah.